So we've had 3 quite interesting pieces of data today. Could you please comment on all 3 if it's possible? It would be really great to get your independent view of the 3 studies that we heard about.
Yeah, so the first study that has been presented is the CheckMate 238. This study really showed that nivolumab, a PD-1 inhibitor, compared to ipilimumab, does bring substantial advantage in terms of relapse-free survival in fully resected stage 3 melanoma. So this is really exciting news because ipilimumab is fairly toxic. This is ipilimumab 10 milligram per kilo, and clearly to have now this new option with PD-1 blockade, which is much better tolerated and that does bring significant improvement, is really exciting option for the patients.
And then we heard about the COMBI-AD study as well.
Yeah.
So do you have any comments on that one?
Yeah, the second study that was presented is COMBI-AD, which also did bring unprecedented benefit in terms of relapse-free survival and overall survival. The numbers really speak for themselves. The hazard ratio for relapse-free survival is 0.47, which is the strongest signal we have ever seen in this patient population. So clearly this sets dabrafenib plus trametinib as a definite new option for the patient in this situation.
How are clinicians going to choose between these 2 options for their patients, do you think?
So selecting between nivolumab or dabrafenib plus trametinib will be a difficult call. I think with the data that we have at hand now, they are both extremely effective treatments. I think the profile of toxicity is slightly different, the mode of administration as well. And I think it's going to take a discussion with the patient. The different aspects of handling the toxicity will be really key. I think we are used to doing that in the metastatic setting, and I think the same discussion now will be made with our patient in the adjuvant setting.
I did have a question about the COMBI-AD study. I wondered why they chose placebo as a comparator and not an active comparator, because it does sound like there are active comparators available.
So yes, COMBI-AD had placebo as the control arm. The study started way before we had the results of the EORTC trial showing that ipilimumab improves survival. So this was the legitimate control arm at the moment. If now we have to start a new adjuvant treatment, of course the control arm will be an active treatment arm.
So do you think there are likely to be further studies with an active comparator control arm, or do you think like dabrafenib and trametinib have made it, so to speak?
No, probably there will be newer studies coming with newer drugs in the future, but of course now they will need to be compared to either PD-1 or BRAF/MEK inhibition.
And then the final study we heard about was the BRIM-8 study, which unfortunately was not positive like the other 2. Do you have any comments on that study?
Yeah, the BRIM-8 study was started very early at a time where the importance of the MEK inhibitor associated to the BRAF inhibitor was not so clear. And I think now with a longer time, we know how important it is to have the double inhibition. So clearly, I think the study has suffered from having a single inhibition, and probably in the future, that will not be the path that will be followed.